Hello, my name is Joseph Jabor, and I am a PGY3 resident at Henry Ford Macomb Hospital. I am here to present our QI project. Title is Delineating Procedural Days in the Trauma Setting at a Community Level 2 Trauma Center. The contributing authors are listed as follows: Brooke Burgess, next is myself, next is Brooke Ndoy, and lastly, Dr. Emmett Chopra. So, introduction here. We have emergency departments in the United States are experiencing increased patient volumes and prolonged holding times. This is something that has been up and down. We have noticed over the past few years with the COVID pandemic, but currently at this time experiencing a surge. One part of emergency medicine that has been impacted for length of stay for trauma patients is just disposition planning delays. At our hospital, we have both a trauma surgery resident team and then the emergency medicine resident team that share different roles with the trauma patients that present to the emergency department. We have institutions that implement the collaboration of the trauma team to have reduced time from ED arrival to CT imaging, to going to the operating room, and then eventually to discharge versus admission. So our project was specifically aimed to delineate the procedure days between our trauma surgery and emergency medicine teams to see if that would improve efficiency regarding disposition times. So what we did was a retrospective review of all of the trauma activations at our level 2 trauma center. The comparison was December 2020 and December 2021. The cohort of patients in December of 2020 was used as our control, and then the patients in December of 2021 was used as our variable period. Basically, in December of 2020, there was no delineation of procedure days. It would mostly just occur based on whoever was available. And then in December of 2021, there were specific delineation of days, odd days of the month being for trauma surgery to perform procedures, and then even days of the month for the emergency medicine residents to perform the procedures. What we had done was review the arrival times to disposition in the EPIC EMR, and that was recorded in hours. For the statistical analysis there, we used a calculation of the mean, and then we were able to get t-test values between the two cohorts, between those means, and then we got a t-score and a p-value as a result of that. So for our results, we have there 2020 was the no delineation of procedure days, and 2021 was delineation of procedure days. So the mean length of stay in hours in December of 21 was 5.13, and for December of 2020 was 3.65. Statistical outliers were removed from the data. This was determined by greater than 3 standard deviations from the mean. And for December of 2021, then we have a mean of 4.48 hours, and December of 2020, a mean of 3.56 hours. As you can see, there's not there wasn't a lot of data removed comparing the ends between the two means. December of 2020 was just one outlier. And then in December of 2021, there was 4 outliers, N of 98 versus N of 94. So what we did notice in calculating the t-score and the p-values, there was a very large statistical difference with a p-value of 0.0008. That was with greater than 95% confidence interval. So for the discussion here, looking at the data, there was a large difference in the mean disposition time between December of 2020 and December of 2021. Um, what our data is suggesting is that having strict procedure days is less efficient, almost so by an entire hour. Um, Perhaps a reason for this is that previously, whoever was most readily available was performing the procedure versus having to wait for a particular service if they were less ready to perform the procedure. Um, there are some limitations here. One is increased ED volumes in 2021 compared to 2020. Staffing shortages during this pandemic has made a big difference in the efficiency of the emergency department. And then how precise the time stamping was for actually recording the data. Whoever was putting in the disposition for the patient and whoever was recording the arrival time for the patient perhaps did not happen immediately as it should. So our conclusions are that strict procedure days are less efficient and increase time to disposition. And what we suggest for efficiency is that the most readily available resident should perform the procedure to expedite disposition time. And that is all for our presentation. Here are our resources. Thank you so much for your time.